This might be the most technically boring video I've ever made, but it's also one of the most important because it lays the foundation for understanding how our healthcare system in the United States completely fails to function financially and on a much more technical level as well. Think of it like a building block to the rest of the information we'll be discussing in this series. Today, are you ready to hear what we're talking about? Today we discuss how the government expects us to pay for insurance, health insurance, bought through the Affordable Care Act. Let's go. So, the financials of the ACA. Why? Because we are diving into all aspects of the healthcare system in the United States so we can understand the disaster that it is a little bit more, because you can't fix something if you don't understand the details of why it needs fixing in the first place. If you're new to this series, hi, I'm Liz. I'm a family nurse practitioner and I'm mad. I want you to be mad about this with me. And this is a really weird video for you to land on, but hey, welcome all the same. I have a link to the full playlist in the description down below, as well as links to additional resources and videos I think you will find helpful. All of the sources that I've used to gather the information for this video are also in the first pinned comment. So the last time we talked about the different healthcare plans offered under the ACA, we talked about how much they cost and all of that jazz. We learned that it's really, really incredibly expensive and cost prohibitive, and introduced the idea of tax credits and subsidized healthcare that are meant to make affording healthcare easier when using the marketplace. So let's dive into the finances, which includes math, which was not fun. I had to use a fancy calculator to get some of the numbers because, as you will see, they are quite high, and it turns out my regular calculator, my little manual one, it doesn't go that high. I was like, that's not a good sign. But alas, here we are. Okay, so let's start off with the basics. What is a subsidy? A subsidy seems to be an interchangeable word with a premium tax credit, or as it is also referred to in the same literature, just a tax credit. What is a premium tax credit? Basically, it's money you can subtract from the amount of taxes that you owe. What is the point of it? Well, according to healthcare.gov, a tax credit is used to lower your monthly insurance payment, aka like your premium you pay, just to have the privilege of having insurance, when you enroll in a plan through the public marketplace. Tax credits are based on the income estimate and household information entered when you fill out your marketplace application. Also, fun fact, this is not a normal tax credit. I don't want to talk about how long it took me to realize that when I was researching this, but the word premium, it was more important than I initially thought. Premium tax credit goes towards healthcare premiums, hence premium tax credit. Send help. I was like, why am I the one making this video? Because this is not my thing, but we're here, and we're doing the thing. So what makes this different from other tax credits is that they are available immediately upon applying for healthcare from the marketplace, rather than having to wait until tax season at the end of the year in like one lump sum. So you can see that monthly costs go down right away on your premium, which is good because it probably reduces the amount of heart attacks experienced when looking at those prices. So who is eligible for these tax credits? Tax credits are available for individuals and families with incomes between the federal poverty line and 400% of the poverty line. So what does that kind of look like today? Actually, this data is from the end of 2021, if you're fact checking me, but you know, same thing. New year, same disasters. You are eligible for premium tax credits if you earn less than $51,520 annually as an individual and less than $106,000 as a family of four, based on the federal poverty levels of $12,880 and $26,500 respectively, depending on how many people are in your family. Additionally, tax credits are available to immigrants who aren't qualified for Medicaid because they aren't a citizen, because, you know, you don't deserve to have healthcare if you don't come from here. It's like, it's kind of like the people that made all of these rules, like watched Mean Girls and thought that that was a brilliant way to run an entire country. But instead of healthcare, it's like,
she doesn't even go here.
You don't get anything. Who are you? No, don't be less mad. We need the mad. Anyway, I'm trying. Can you tell I have feelings about this? But all in all, it doesn't sound too bad, right? Well, not all tax credits are created equal. The tax credit you are eligible for varies greatly based on where you live, the actual amount of money you make, and because of this, people often have to choose between a raise or a better paying job and health insurance, because whatever that raise might be, it might change the dollar amount of the tax credit they are eligible for on their health credit, but the difference may not be enough to cover it, like the difference, how much money you're making in your raise. So say you make $20 an hour and you work 40 hours a week, and your boss was like, hey, great job, you're doing wonderful. I'm gonna give you a whopping $1 raise. So you're gonna make $21 an hour. That $1 an hour, so $40 a week, may bump you up to the next bracket in terms of what you get in premium tax credits. And if that jump is more than $40 a week, you suddenly bring home less than before you got a raise. Like, make it make sense. I interviewed my sister about this in a previous video. I will link it down below, but she was an example of how this can just like really, really screw you over. So that premium tax credit, which remember are sometimes referred to as subsidies for reasons, and all of this should not be confused with subsidized healthcare, which they didn't name something different also for reasons. So you might be asking yourself, okay, Liz, so what is subsidized healthcare? According to healthcare.gov, subsidized healthcare is health coverage available at a reduced or no cost for people with incomes below certain levels. Examples are Medicaid and Children's Health Insurance Programs, or CHIP. So it's programs like this that allow people in specific groups to access healthcare for either no cost or at a significantly reduced cost. So let's do a quick rundown of what those are real quick. Medicaid offers healthcare coverage to low-income families and individuals with disabilities. It is both federally run and state run, in that the federal government says states have to have it. You must exist. And because I feel like a lot of them would just be like, I'm just going to opt out of that entirely. So thank goodness we have that. And it says you must exist. And they're allowed to suggest federally how far it should extend, like, hey, you should cover these people, but states have the last say in how far it actually extends. In order to qualify, individuals or families must make below a certain amount of monthly money, or have below a certain number of assets to their name. The complete insanity of how this actually works in real life sounds like a great idea for a future video. Cheers. Do you like my new mug? My sister got me a future video mug. So cute. So to give us a little bit of a perspective, for 2021, this was the basic rundown of the numbers. In order to have full coverage under Medicaid as a single person household for adults aged 19 to 64, you had to make less than $1,482 per month. For a household of two, it was $2,004 per month. For three, $2,526, and for four, $3,048. These monthly amounts are incredibly low. So it's really easy to get that $1 raise or work some overtime and accidentally lose your Medicaid status by being a good employee. Now, there are other ways Medicaid can help with beneficiary pay, disability pay, Medicare Part D, and all of that. And I'll have those on the screens here. But there just isn't time to get into all of that here. If you want a full breakdown of all of Medicaid, let me know in the comments. Future video. The point of this is that earning more money can sometimes mean risking your health care. If you just need regular basic health care and there are participating practices in your area, you are pretty well covered. But if your monthly income rises just over the financial limit, you are on your own. And at these low income amounts, even just above these limits, most employers are not offering health insurance through a job. So you are going to have to, again, look on the marketplace, and you will either be stuck with a bronze plan or a catastrophic plan that you can't even use, but you still have to pay for. So in essence, you will really risk losing your health care if you try to get that raise or a different job that pays better. If you want more info on this, check out the video I did on breaking down all of the different marketplace plans. In the video where my sister tells her personal story about having to choose between a pay raise and having health insurance. So you may be saying, why Liz, these are just like such random fun facts, but Why do we need these premium tax credits and subsidized healthcare anyway? Why did we have to learn about this? If the government is going to pay for tax credits and subsidizes healthcare, why not just lower the cost of healthcare to make it affordable from the start so we don't even have to do all of this? Well, it comes down to the cost of the healthcare in the United States itself. In a strange way, the Affordable Care Act is almost a misnomer. The care has not become more affordable at all. In fact, care prices are rising at an alarming rate. In fact, they are growing faster than other sectors of the economy. So instead, what the Affordable Care Act does is it takes government funds to help pay for healthcare costs across the standard whole population. But in a system like ours, this could never really be more than a temporary solution, purely because it operates in a for-profit, greed-driven healthcare system. The price of insurance can't be lowered because there's nothing being done to lower the cost of healthcare in general. And it seems like nobody thinks this is a problem. And if no one thinks it's a problem, we have no problem, apparently. But I feel we have a problem. And please, I beg you, please feel like this is a problem with me. Shameless plug to share this video with every human you know, every human you don't know. Actually, maybe go back a few. Some of them were maybe more entertaining than this one. And you should also like and comment too, because the YouTube gods smile at this and it helps promote it to other people on the internet. Anyway, moving on. So what makes healthcare so expensive in the United States? Well, as with anything, it's complicated. And something that needs its own video. Cheers. I'll see you there. And oh boy, are we going to do one on that later in this series, but we needed this one in order to get that one. You know what I mean? For now, it can be summarized as a combination of a lack of price regulation, high but unnecessary administrative costs, mismanagement of funds, and operating as a for-profit business, which sounds like the setup of a horror movie when you put it in the context of this is all involving healthcare. But I digress. As we've established, the Affordable Care Act was implemented to help offset some of the costs of healthcare for people who need it, because the system isn't getting any less expensive. So people need a way to pay for this care. How much does the government actually spend on healthcare then under the Affordable Care Act? Well, let's take a look. In 2020, the US spent 19% of the GDP, gross domestic product, on healthcare, which is up from 17% in 2019. Kudos to all of you who know what GDP is, because I sure didn't. The internet says it's the standard measure of the value added created through the production of goods and services in a country during a certain period. Obviously. And I asked my dad, because I was like, I don't get it. And my dad said that this means the dollar amount of stuff a country produces a year. Kudos to you, Dad. Thanks for your help. So I think that means that we spend about 19% of our money as a country on healthcare. People who actually listened in econ, please, like, I beg you, am I on the right track with that? Am I even on a track? Am I on a road? Please help me. Tell me if that's right. This increase in percentage of GDP is partially due to the COVID pandemic and the resulting economic crisis. And the US is not the only country that saw an increase in their healthcare spending. The next highest comparable country is the United Kingdom. They saw a rise in spending from 10% of GDP to 13% in their healthcare, but still nowhere near like where we're hanging out. So what does this look like in terms of dollars? In case you too are like, GDP, yeah, good. In 2021, according to the Congressional Budget Office, the government spent $683 billion on Medicare, $519 billion on Medicaid, and $68 billion on premium tax credits and related spending, and $16 billion on CHIP. Those are all billion with a B. That's a lot of money. But what does that mean for you and me practically? In 2020, according to the source Health System Tracker, I will leave it linked down below with everything else that I have found here. The average dollar amount spent per person in the United States was about $11,945 per person is what was spent on health insurance, which when compared to spending of comparable countries is quite horrific, since they averaged around $5,736 per person. And just as like a cherry on top, our outcomes are way, way worse than all of those countries too. But alas, that is another video for another day. Cheers. But it's still embarrassing, and we can say it's embarrassing in this video. Look, like this graph compares health outcomes to the cost of healthcare. Most countries, we see they're spending a good chunk of money, but they have really good healthcare outcomes. We spend an astronomical amount of money and completely fail to perform. Find the US on this map. Go ahead. I'll wait. We're the loners down there. But I'm sure we're the ones who have it figured out, right? Right. It's not everyone else is doing it wrong. We're definitely on the right track, I'm sure. If we take a rough estimate of the US population in 2020, that is a total spending of $3,935,877,500,000, which is insane. That is how much we spend. That was the thing that my calculator couldn't go that high. I was like, oh, this is really good. According to CMS.gov, the Centers for Medicare and Medicaid Services, total spending was $4.1 trillion or $12,530 per capita, which is bonkers. Different sources are saying different things. I'm like, why can't we all agree? But just to give it some balance there, which that is still an insane amount of money that I don't think most of us can actually conceptualize, and our calculators still won't go up to. So where does that money even come from? According to CMS.gov, that 2020 spending breaks down like this. 36.6% was sponsored by the federal government, about like 1.5 trillion, and 26.1% was sponsored by household premiums, about 1.7 trillion. This accounts for 62.7% of healthcare costs, about 2.57 trillion. The private business share of healthcare spending accounted for 16.7% of spending, about 685 billion. State and local governments accounted for 14.3, about 586 billion, and other private revenues not specified accounted for 6.5%, or about 266 billion. So all in all, it's a lot of money. And through taxes and premiums, Americans are footing a lot of that bill. But if every other developed nation has figured out how to provide affordable, quality healthcare, why can't we? That's why we're here. We're all trying to figure this out. That's what this whole series is about. And why do we have the worst healthcare outcomes compared to other developed nations, despite this absurdly ridiculous spending? Well, we will be looking into that next time when we delve into our why our insurance costs so much but also sucks so much. Cheers. Excited for that video. The ACA is essentially a patch to a system where there don't seem to be any plans to replace it with a more permanent solution, at least one that works. What does that look like? Well, essentially, healthcare and the ability to pay for both it and insurance controls people's lives. Because of the way tax credits and subsidies work, by accepting certain jobs, maybe if they have a higher wage, someone may not be able to then pay for their health care because their tax credit will no longer cover as much. You may not start your own business because you can't afford to get health insurance on your own through the marketplace. You may not be able to just pay for health insurance in general, or you are underinsured. You have a bronze or a catastrophic plan and you can't even use the health insurance you pay for, and that leads to poor long-term health outcomes when you can't get help for things that could have been, solved in the beginning, but it goes all the way until you're having a heart attack. So that's why this was important. We needed to understand what the financial basis was so we can see how it relates to the outcomes. And on that incredibly positive note, I congratulate you on making it through the math video. Please congratulate my sister for helping me research most of those numbers. Numbers are not my thing, and they're really not her thing either, so this is like Mount Everest for us, okay? But we did it. This was a crucial building block, though, for the more dramatic videos that are coming up that are more like, they make more sense. Please subscribe to see those. Share this with someone who may like it. And remember, we can do hard things, like fixing healthcare in the United States. Until next time, friends. Bye.